Menopause is such an opportunity to finally live the life you were meant to. It's such a blessing to be able to look back at life, to be able to age, to be able to reflect on what didn't work for you and how your hormones now are giving you this opportunity to heal those stories so we don't have to pass them forward. Like stepping into your wise woman years is such a gift because you're coming in with all this wisdom of what worked and what didn't, and now you get to make that daily choice for you. And from that space, you're able to give to your world, to your community from such a different place instead of from a place of burnout or people pleasing, but just authentically from yourself. So I think menopause is a gift.
All right. It's a real pleasure to have Sonya Jensen on the show today. Welcome.
Thank you for having me.
I'm really excited to get deep dive into hormones and what that means for a woman in menopause and perimenopause, probably even more. And you've got a book, Heal Your Hormones. This is such a relevant book for us right now. And you talk about healing hormones, not just replacing them, which we talk a lot about with hormone therapy. So for women in perimenopause, even in postmenopause, what does healing hormones actually mean in practice?
Yeah, that's a great question. I think it's really understanding the hormones and the messages they're actually trying to give us because they're telling our story. And so often women at that stage will have various symptoms from fatigue to irritability to frustration to anxiety to depression to low libido to vaginal dryness. There's such a variety of symptoms that women may experience, and we often blame the hormones, not realizing they're actually an effect, not a cause. And so healing your hormones is really understanding the dynamic between your nervous system, between your hormones, between your emotions, and how that's impacting your body and then is impacting your relationship with not only yourself, but everybody around you. Yeah.
I heard on another episode, you were, I don't know where it was, but you were talking to somebody else. And I really thought it was interesting because you said the way you talked about hormones was different than what we usually say in menopause with the loss of estrogen or the fluctuations of our estrogen. And we're always blaming estrogen for a lot of things. But the message I got from you is more, it's not just losing your sex hormones. It can be your insulin, it could be your cortisol, it could be your thyroid, it could be many other things going on in the body that are affecting the hormones. But in perimenopause and menopause, we're like, loss of estrogen. Okay, let's put it back and that's everything will be dandy again. But it's not quite that way.
No, there's this huge choreography that's going on in the body when it comes to our hormones. So estrogen is impacted by many other hormones like cortisol, like insulin and adrenaline and all the things that we're navigating in everyday life. And so the estrogen gets blamed because yes, physiologically there is a loss. There is a change. There is changes in the receptors everywhere in the body for estrogen. So estrogen is a key player in the whole scenario, but we want to take a bird's eye view and look at okay, what's actually impacting the rate at which we're losing estrogen. That I think is the biggest challenge because I'll get this question from people, aren't we supposed to lose them anyways? Like, didn't nature do this on purpose? And yes, absolutely, there's changes that happen, but our body is still producing estrogen after menopause, but just from different places. And the rate at which we're losing them is because of the lifestyle and the stressors and the things that we've had to navigate before menopause, which changes our transition and just our experience of what menopause actually is.
So you mentioned the rate of loss affects our menopause experience. That reminds me a little bit about some of the factors that affect the age of menopause. And the average age in the Western world is somewhere around 51, so whatever. In other countries, it can be earlier or even later. But the genetics play a big role. Okay, we can't control that, but there are other things that we can control. And is there something that's accelerating the loss of the,
Mhm.
let's say, estrogen or the hormones in general that can put us into an early menopause?
Yeah, like you said, we're born with certain number of eggs, so that we can't really control. But then looking at actual estrogen and looking at the rate of the loss, there are things like stress that will impact it. So depending on the story that we're carrying, so if as a child we had traumas happen, or as a teen we had struggles that we were dealing with, and depending on the pattern in which our body got used to operating in, so if the body got used to operating in the state of survival, it was already telling your estrogen, progesterone, and testosterone to take a back seat. So at the forefront was your cortisol just to help you navigate life. And so when we're going through these stages under that level of stress, we're already depleting these stores that we have of our estrogen and our progesterone and just allowing them to misbehave a little bit because we're changing how they're communicating within our body. And just yesterday, I was talking to a patient and she's in her kind of mid 30s and I feel like I'm too early to be going through this. And she's losing her period and there's longer stretches in between her cycles and her FSH is starting to go up. And what I've seen over and over again, so some people would say, okay, she's got early onset of menopause, but as we start regulating their nervous system, as we start regulating their other avenues that are impacting her estrogen, like her gut, like her liver, all of a sudden the estrogen comes back up again, and then she's bleeding regularly. So I think there's so many things in our environment. If we really look at how our hormones work, they're responding to the environment. So if we change the environment, we change the level at which our hormones are starting to decline.
Yeah, no, it's so very important. What would you say if somebody says, can you delay menopause?
I think that's a nuanced question too. We said there's a certain number of eggs, so you may be that once you hit 50, those eggs have been used up and there's no more estrogen coming from your ovaries. So that part I don't think we can delay. There's things that can happen throughout our life, like pregnancy will delay it a little bit. Birth control will delay it. So these things where we weren't ovulating, those moments in our life will change. I don't think by very much. I don't think it'll change it by years, but I think it will push it. And then there's theories around using HRT for really high doses of HRT, which will get women bleeding for long periods of time. It doesn't mean you're having true ovulation and you're actually producing those eggs and that estrogen and progesterone from that, but instead you're manipulating the system to make it look and feel like you're having a cycle every month.
Yeah, that's very nuanced because when
Yeah.
you do take HRT before the 12 consecutive months without your period, which defines menopause, you
Right.
don't know what your meno birth date is.
Yeah.
Because if you are doing the cycling and the bleeding, if you don't, then you don't. But if you are cycling progesterone, for example, using it from the last 2 weeks of your quote unquote cycle, assuming, but you're making this transition with a normal cycle or wonky cycle, but you have normal bleeds with, because you haven't entered in menopause yet. And then when you enter it, you don't really know. And so
Mhm.
how does somebody, one, does it even matter if we know our menopause
Right.
date? And two, how else would you know?
Yeah, good question. I think women will symptomatically start to feel different in their bodies. And the only way we would still have this cycle going forward after menopause in the same way is if we're really doing high doses of hormones. If you're doing actual physiological doses, I like to use with bioidentical hormones, you will stop bleeding eventually. So I think it really depends on the type of hormone therapy that you're using. And symptomatically, you would know when you're transitioning because you won't have those ups and downs throughout the month that you normally would when you have a cycle. So, for example, around ovulation, your libido goes a little bit higher. And before ovulation, you have more energy. There's this cycle that your body goes through. After ovulation, you're feeling a little bit more inwards, maybe a little bit more fatigued. And so we get to know this pattern that we have throughout our cycle. That pattern becomes a little bit more, every day feels a little bit more similar than it did before. So that's one way. And then the other way is actually testing and looking at your hormones, coming off of the HRT and seeing, okay, where's my FSH? Where's my LH? Where's estrogen? All different types of estrogen, what they're doing in my body, and looking at it from that direction.
So, what would you say is a high dosage or physiological level?
So, what I have seen over the years, I had one woman come to me. She lived in England and then moved to Vancouver and still wanted to continue her HRT. She was taking 100 milligrams of estrogen.
100 million, but what is that? What does that in the blood look like? Because we know this
Oh,
is
so in
taken.
yeah, so in the blood, hers was looking between 600 to 1,000. It was going in between there, which is quite high, even for a cycling woman. And her progesterone was a lot lower than that. But she was on such a high dose. I have her on 1.25 milligrams right now. That's how low we got. And she's still getting the benefits of estrogen. She's still feeling really good, but she was on such high levels. She didn't want to bleed anymore like she was. And so we got her down to this physiological level, and she's still really thriving in her menopause years.
Why don't you explain that a little bit? Because there's super
Yeah.
physiological levels and then
Yeah.
there's physiological levels, and then maybe
Yeah.
explain the different levels so people understand.
Yeah, so when you look at blood work, I tend to do more urine testing when it comes to the different types of estrogen, but when you're monitoring HRT, it could be helpful just to look at blood work. And so when you're seeing less than 40 when it comes to estrogen, that the woman is getting less estrogen in her body. And so physiological dosing is just upping it a little bit. It may go up to 150, maybe 200. And so when you're in that physiological range, it's what the body needs to feel supported and needs to still get those benefits for her bones, for her heart, and for her brain. But when you start going supraphysiological, you're actually creating thickness in your uterus and you're actually starting to shed parts of that uterus. So women may start spotting every month or even throughout the month, is what I've noticed. And so the difference is there's different theories that if you have those supraphysiological dosing, that you're protecting your bones and your heart more than you are with just the physiological dosing, the lower. But what I have seen over the years, same benefits. If anything, the lower amounts to me, feel safer, and women like them too. But the super physiological just to me doesn't make sense, to be honest.
When I interviewed Dr. John Newstead and Dr. Doug Lucas about bones, these are bone experts,
Yeah.
they told me that you only need to have in your blood of estradiol 7 picograms per ml to stop
Oh,
bone loss. And
okay.
then to actually build bone, it was 20 picograms per ml. And if nobody knows what this means, it's very low,
That's
super low.
really low.
And I thought that was weird. How that being said,
Yeah.
with their patients, they like them to get, I think, between 60 and 90 or 100 grams per ml, even though the research that they're quoting, that is just so low. You would think, then why are we all having osteoporosis and
Yeah.
osteopenia? Because
Mm,
most women are pretty much that low level, but unless they're postmenopausal, then it goes even
mm,
seven was really low. And that really
mm,
surprised me. But again,
mm.
yeah, they do say, look, there's a lot of other benefits that you get with higher
Yeah.
dosages. It's just, this is what the research is showing today, and it could
Yeah.
be changing tomorrow, right?
Yeah, absolutely. And I don't know if the blood test that you looked at, but we usually just get a general less than 40. We're not even getting the numbers, the specifics. So to hear 7, that's great. But yeah, I do think a little bit higher would be nice just for those other benefits.
Yeah.
Yeah.
What's interesting because one thing you can maybe explain to me, I changed doctors and she said, why don't you try the patch? I've always been taking a
Mm,
cream, a
mhm,
compounded cream usually seems to be working best for me. And I get around,
mhm.
I don't know, 150 to 200 picograms per ml in my blood and
Yeah.
feeling fine. And so I said, okay, I'm going to take the patch. So she puts me on a 50 microgram patch,
Yeah.
I guess zero point 0.5.
Yeah.
And I thought that was really great. I was like, wow, this is amazing. You just put this on your belly and that's it and change it every few
Mm,
days.
mm,
How nice. And I really liked it. However, when I tested myself, I was, I think about 44 picograms per
mm.
ml, which is quite low. And I was feeling hot at night. This is probably too low for me. Then I tested. But the weird thing was I had a bleed. I always had
Mm,
this sort of
mhm.
fake bleed, just a couple days and then done. And how is it that I have, and my FSH was like 58.
Mm.
And I thought, how in the world, why does this happen that I have a bleed with so maybe
Yeah.
it's residual from before. Can you explain what's going on?
When you did the cream, was it just estradiol or was it biased?
It was estradiol.
It was
Just
just estradiol, and you were doing it perivaginally or vaginally
no, I was doing it on my arms.
on your arms. Okay. So absorption through transdermal, I think, is we don't totally know how much we're getting transdermally. So I often do estrogen vaginally, so to get it in that same pelvic circulation, which was familiar from the ovaries. So from what I know, depending on the type that you're getting, estradiol is the builder. So we actually always add estriol to stop that building so that we don't get the spotting and we don't get some of that lining getting a bit thicker. So if you are bleeding or if you are spotting, we usually get women to do an ultrasound just to see what kind of impact it's having on the uterine lining at that time. But when it comes to dosing, zero point 0.5 is actually a pretty small dose. So I am surprised that it created that. It may have just been localized where you had the patch because going into that circulation, and maybe you weren't getting that much with the cream because it was transdermal. It's so dependent on the carrier of the cream as well. So I think
No,
that's,
but I stopped the cream and changed to the patch.
yeah, that's what I mean. So you might have been getting even less with the cream than you were getting with the patch, possibly.
When I tested with the creams, I was around 150 to 200.
Yeah, I'm just curious about the impact, like direct impact to the uterus. So it may have been just more of what you were getting with the patch. It was just building more, whereas the other one, it was free. Like you were getting, it
Yeah.
wasn't attached to the receptors. It was in the blood. Yeah.
Yeah, we don't think about this. So I do think about this sometimes, but in
Yeah.
general, we don't talk enough about it in terms of
Yeah.
where you apply. So you're
Yeah.
like, oh, there's this patch really close to my uterus rather than my arms, which
Yeah.
are further away, would it have
Yeah.
more of an impact, or even vaginal. When you think about, oh, wow, it's vaginal, that's also much closer to the uterus than
Hmm.
on my arms.
Yeah. And the vaginal can be actually really nice for the tissue in that area. So a lot of women will complain about dryness or feeling like it's sandpaper down there, and then using it like a vaginal cream can really help that area up too.
So the vaginal cream, if somebody's using estradiol, let's say that's it. I'm going to use my systemic hormones, but I want to use it vaginally. They need a special for vaginal formula rather than the one that I would be using on my arms. I couldn't be putting it into my vagina.
Yes, you would need it compounded, and I would actually add estriol to that compound so that we don't get that buildup in the lining or the spotting. So I usually do an 80-20 combo, so 80% estriol and 20% estradiol. And then depending on symptoms, sometimes I can change to 50-50 or 70-30, really depending on what the woman is needing in that moment.
Why does the estriol stop the bleeding?
So that's its function. So estriol is really high when we're pregnant, so that with this upload of extra hormones that we have during pregnancy, we're not bleeding anymore and we're not creating a lining in the uterus. So its job is to contain estrone and estradiol. And so by putting them together, it's a weaker estrogen, so it doesn't bind to the receptors as well as the E2 would. But what it does, it still gives you similar benefits when it comes to your bone and cardiovascular and all of that, but it doesn't have the same impact on your uterus.
Okay, so just for people to know, E2 means estradiol
Estradiol, yes.
for two, estradiol. But progesterone takes care of the uterine lining more than.
Yeah, so the combination of the two, you always want to oppose estrogen with progesterone, absolutely. But I find that estriol has more of an impact because I've had women just do estradiol and progesterone and they still start spotting without the estriol. So
Hmm.
it's again, it's so nuanced when it comes to hormone therapy. No two individuals are going to have the same therapy that's going to work for them. And so for one woman, the estradiol is more beneficial and she's doing progesterone, whereas another one, the biased, is more beneficial for her. So yeah, it really
So
depends.
do you think that, so if somebody's taking progesterone statically every single day of the month,
Hmm.
they can still have a bleed?
Yeah.
Okay, I thought it was the cycling that.
No, I've got women on every day, but I'll increase it in the last half. So
Mhm.
if I'll maybe do a lower amount, because you don't really need a lot of progesterone in that first half if you're still cycling. So I'll do 50 milligrams, then go up to 100, perhaps right before those 2 weeks.
So the when somebody takes estrogen, estradiol, usually it increases the uterine lining. It's proliferative. It makes things
Hmm.
grow, and that's a good thing in
Hmm.
some ways, and not so good with the uterine lining. And that's why if
Hmm.
you still have a uterus, then you want to take progesterone to oppose that.
Hmm.
But I'm curious, if you're not bleeding, if you just
Hmm.
these people, fine, you don't bleed. Is it because the estradiol is not high enough to actually create the thickness, and then there's enough
Hmm.
progesterone to oppose it,
Yeah.
but there's still a lining, right?
Yeah, absolutely. So there's a thickness that you look at. So you want it less than 5 to 4 millimeters of thickness when it comes to your lining when you're postmenopausal. I've seen some women go up to all the way up to 7 just because their dose was so high. So then we have to bring the dose back. And yeah, again, it's so nuanced when it comes to the that hormone support.
Yeah, I think there's,
Yeah.
if you heard Dr. Louise Newson, she did studies, I think over 1,000 of her patients, and she said
Yeah.
that there was no correlation with high estrogen and then people have
Hmm.
a thicker uterine lining, or she didn't find the correlations that we always talk about. So she
Yeah,
was
that's
saying,
interesting.
we're all bioindividual. Just go and
Yeah.
test it. Go look. We don't know. I really like that approach because in the end, we say this and you're protected. I don't know
Yeah.
protected.
Yeah.
Go and check
Yeah.
and you'll know.
And that's why I keep saying it's so nuanced. Every woman, it's going to look so different for you. And it's because of those stories that we're carrying coming into that space. And that's why I like to look at the why. I like to understand what's your story before you reached menopause? What are the stressors you've been carrying? What's the life you've had? What were your pregnancies or not pregnancies look like? It's just looking at all of that is going to impact her response in menopause and her response to HRT or BHRT. So I think it's so important to unwind all of that and see, okay, what's impacting my hormones. I remember when we first started doing BHRT, this was years ago in 2012, we studied under an OBGYN, and at first I was very much in that naturopathic space of our hormones are supposed to decline. I don't want to replace them. I just want to work on lifestyle. And then as I started using them with women and started to see the changes and how it was impacting them, I saw the power of these hormones. And I would see, okay, the woman that was just doing the hormones because she had time for nothing else, she would hit plateaus and she would need larger and larger doses to hit that same level of calm in her body or help her sleep or help her libido. But the women that were doing the lifestyle, that were working on their digestive system, that's supporting her liver, that's working on her nervous system, especially, they could be on those lower doses and feel great. And so I think when it comes to hormones, it's not just the hormones that we want to be looking at. We want to be looking at everything that's influencing them.
Yeah, I agree 100%. I want to ask you a question about the story that you bring into menopause. But before I do, a quick question about if somebody's getting their uterine lining checked,
Yeah.
and a lot of women don't know this, but if you're on hormone therapy, then it's good to check. But should she be just trusting her doctor that she does that, or should she say, look, can you tell me how many millimeters there are and look for between 4 and 5?
She should be able to see that on her report, but I would check. I would ask for
Yeah.
sure. Yeah.
Yeah, I'm gonna ask next time because I always get it, and they're like, "You're fine." I'm like, "Okay,"
Yeah.
but now I'm going, "No, no, I want to see. I want to make sure
Yeah. I
I'm
want to see
on
what it
this
actually is.
thing."
Yeah.
So
I like to always see my reports. Yeah.
yeah, I'm going to ask next time. And the other thing, just in case people are listening and going, what is this BHRT and OBGYN? What does that
Yeah.
mean? The BHRT is bioidentical hormone therapy, and the OBGYN is obstetrician gynecologist, is your
Mhm.
doctor. Just to clear some of these things up. But maybe some women are also confused about bioidentical versus what's not bioidentical. So I do
Yeah.
want to cover that as well. We'll put a pin in that. But you
Mhm.
mentioned the story that you bring into
Mhm.
menopause, and I think this is really important
Mhm.
because very often I get calls and messages from women saying, I'm feeling like this. I'm feeling bad. Is this my hormones? And I
Yeah.
said, what's going on in your life? And they would say, I just got divorced, or I'm moving,
Yeah.
or my children are now flew the coop. And I said, well, hormones are no hormones. This is life, and that's stressful, and you're going to feel bad. But what I'm seeing is that they're less resilient. I used to be able to handle these stressors in life, but I'm not as resilient. So I always think it's two things, actually. Yeah,
Yeah.
with the loss of the hormones, probably not helping anything, but you can't discount the stress that's happening in life, the things that are going on. And I think I heard you also mention in this other podcast is that if you come into perimenopause already with insulin resistance or overweight or struggling with autoimmune disease or other issues, they tend to be exacerbated. So it's not, let's just blame it all on menopause.
Yeah, absolutely. That piece is so important because that is when women start to feel everything is just amplified. Their emotions are amplified, their symptoms are amplified, and that can create some chaos within because she feels like she's losing herself and not knowing how to respond to her changing body. And so, yes, we have this loss So then the coding that our nervous system got, or the protection that our nervous system received from our hormones, is no longer there, or it's slightly there, but it has this window of vulnerability to help us heal those stories that we're carrying in. So if we've been playing out the role, for example, of the people pleaser or the silent struggler that was doing everything for everybody else, not for herself, and maybe that was our protection because of an experience we had in our past, or the woman that is dealing with that autoimmune disease that couldn't ask for help, couldn't slow down, and now she's in a state of burnout at this stage because we don't have that protection anymore, because our window of tolerance is so much smaller and that emotional resilience just isn't there. And it's there on purpose, I feel, so that we can look back, we can reflect and see what are the missing pieces here and what identities do I need to let go of, what roles have not been serving me, and how do I want to step into this next phase of life with clarity and with command of what it is that I need for myself. But that transition between those two can be really rocky. So when your brain isn't getting the estrogen that it needs to boost up that serotonin to feel joy, or that dopamine to feel that pleasure, or when your progesterone's not showing up to give you that calm through GABA, then those triggers in our present day are going to feel bigger and amplified because we haven't healed what was already there. And so it may be there's something going on in your relationship, or something in traffic, or just overwhelmed by a deadline, or your kids talking over one another. The sounds are just too much. And it's, yes, it's about the present moment, but it's often about the fact that we've been living out this pattern that just hasn't served our nervous system, which then hasn't served our hormones.
Mm. Chewing gets amplified too,
Oh my
and
gosh, that's
breathing.
the worst for
Not allowed to
me.
breathe in front of me.
No, the chewing granola especially. I don't know what it is about that crunch, but it's
And
not
worse if the
good.
mouth is open, chewing.
Yes.
It's amplified. It didn't bother me before, and
Yeah.
now it's okay. But the whole tolerance thing that's going
Yeah.
down, I always think it's a bit of a superpower. I think it's tolerance for this anymore. I'm just not going to
Yeah.
take it.
I can speak my truth now.
I'm
Yeah.
done.
Say
Yeah.
it how it is. Yeah, I do think it's a superpower. I think it's more daunting when I had a mom come in one day and I'm overreacting to my kids and it's changing my relationship with them. And I don't want, and I can't even control it. I can't even control myself in that moment. That's where that discernment needs to come in of, okay, maybe physically, physiologically, you're just not getting enough of what your body needs. You're not getting enough nourishment. You're not getting enough hormones. So when we have that foundation, then we can pause, then we can breathe, then we can ask ourselves, why are we so triggered? Is it about this moment? Does this actually belong to me? Then there's space and time to actually ask those questions and heal and understand. But when our body isn't giving us what it needs because it's not receiving what it needs, it's so difficult to feel balanced, so difficult to respond instead of react.
So if somebody comes to see you in the middle
Mhm.
of perimenopause and says that, the things
Yeah.
out of my mouth, I can't control. I know this must be my hormones. I am starting to have joint pain or hot flashes, whatever it is that she has. This is 103 symptoms of menopause. So she names a few.
Yeah.
How do you get started with her? Where do you look first?
Yeah, so I created this thing called the hierarchy of hormonal healing, and I always start in the physical. And so you want to see where she's at because my first job is to build that trust with her so that I can really get to her root story. But in order to get there, if she's not even aware that's what the cause is, it's important to look at what she's presenting with. So I'll start with testing. And we'll do some hormone testing. We'll test her thyroid, we'll test her insulin, we'll test her, all of her hormones. And then I start to tell her story to her through the test. And then she's like, oh, it's not just in my head. My body is changing. There's something actually going on. And so then I'll plant some seeds around different things that she can do in her day. So there's movement, there's nutrition, there's herbs, there's things that we can bring in to boost her up so that she can finally feel better. She can feel a little bit more energy. And then we start to do the mental emotional work of those roots of where is this actually coming from and how can we support ourselves now so that we're not reacting or overreacting.
I like that approach. It's interesting because we know that we can't out hormone a bad diet and lifestyle. So it's just one tool in the toolbox. And
Yeah.
But when we tell women to do the foundation, get some good sleep and manage your stress and go to eat good food and do your exercise
Mhm.
when she's feeling like garbage and she's got
Yeah.
hot flashes and night sweats and just can't, how can you ask a woman to do that? And she needs a bit of support. And what I'm hearing you say is that, well, you test, you figure out what things, maybe she has some deficiencies and you can support it with
Yeah.
herbs and all these other things and other modalities. And maybe HRT is part of the component,
Yeah.
but then helping her with the emotional and the mental is then she feels I can see it's a multi-pronged approach to help her
Yeah.
do what she should be doing, but just
Yeah.
can't get it together.
Yeah, and the most heartbreaking thing for me that I've ever heard is a woman say to me that I'm not worth your help. So sometimes even saying, okay, let's eat this, let's take this supplement, let's move our bodies like this, even that feels like a struggle. So really understanding where she's at with that too, because I have one patient right now who is suicidal, and we just celebrated the fact that she's still here. It's 2026. I didn't know I was going to make it past 2025 and she's still here. And I'm like, see, it was those little things that we brought in every single day to just plant that one seed. Just getting her out of her bedroom was a victory. And so sometimes we think we have to do these grand changes in our lives, but we really need to celebrate those things of I got out of bed today when I really didn't want to. Or I picked up the phone and called a friend today when I really wanted to isolate myself. Sometimes it's those things in combination with that all of a sudden your body's getting that nourishment, then there's hope. Then we can feed off of that hope and then bring in those bigger elements after.
So how many women in the perimenopause and postmenopause age are you seeing who want to have hormones and which ones don't want to have hormones? They come in to you and say, I want to be all natural, whatever that means, but or something else.
Yeah, it's pretty 50-50 with me. I think because of how much information there is out there now. So some will come and be like, I just want to go on hormones. I know it's going to help me. But then through our conversations, she'll start to understand that, okay, it's not just about the hormones. Get her feeling better with a little bit. And then, okay, let's talk about your digestion now and then see what we can do for that. Let's talk about your immune system. Why have you been getting sick so often? And we'll start to do that other work alongside. And then yes, I have ones that are like, I don't want to do hormones. I just want to do everything naturally. And then we find the herbs that are going to support her. We find the lifestyle factors. She knows she's already ready to work hard to get there because it just doesn't happen overnight. And then she learns more about herself through that process too.
You mentioned testing is one of the first things that you do.
Yeah.
What testing do you do?
Yeah, so I do a combination of blood work and also urine testing for hormones. So I will do the Dutch test. And then with that, I will test their fasting insulin. I'll do a full thyroid panel through blood. I'll test their homocysteine. I'm looking at their CRP. I'm looking at their lipids. I want to see their ApoB, their LPA, because I want to get the full picture of her cardiovascular system as well. So those are, I would say, the big markers that I'm doing with everyone, their regular CBC and ferritin as well to check out her immune system.
Good. Those are all in my list of labs.
Oh, good.
And
Excellent.
in case that nobody knows what the Dutch is, it's the dried urine test of comprehensive hormones.
Yeah.
You pee in a little cup and you put these little strips in, you wait for them to dry. It's a way to test urine metabolites and there's other ways. That's just one of the brands that are out there, but
Yeah.
it's a way to see how your hormones are behaving, right? Through
Yeah.
your urine.
Yeah, absolutely. And I love that it gives you this picture of your liver too, and how you're methylating, and whether, if you're on hormone therapy and if your body's not responding to the estrogen the way we want it to, it may be a challenge with your liver. Because a lot of women show up in this stage with estrogen dominance. If she's had fibroids before or challenges, or she's had PCOS. So it kind of gives you clues as to, okay, if I give her testosterone, is she actually going to break that down properly in her body? There's another new test too called the hormone zoomer that does all of the metabolites, but also looks at environmental factors. So it looks at phthalates, it looks at BPA, it looks at all the things that can raise your exogenous estrogens in your body, which I think is great because that's a conversation I think that's needed too, which impacts so much of how we feel physically and even emotionally too.
Yeah, you wouldn't think of it when I tell my husband, careful the plastics. He's ah. whatever.
Yeah.
I don't believe it.
Yeah, because it affects men too. It affects their estrogen levels.
Yes, it,
Yes.
but
Yeah.
you won't believe it. We have evidence for that. And I guess maybe some people are more sensitive than others, or they're able to detoxify better than
I
others.
think
They don't.
that's what it is. If your detox pathways are open, if your liver is more efficient with its phase one, phase two, so that you might have an easier time detoxing what's coming in through the environment. So that's what we do is our environment's full of stressors, chemical stressors, physical stressors, emotional. So if we can bring up your vitality, your ability to handle what's coming in from the environment, from that emotional resilience all the way to your detox pathways, then we can handle what's coming in. But when we're constipated, we're not detoxing well, maybe we have water retention and our lymphatic system isn't working well, then everything's feeling stuck, not only energetically, but also physically. So getting movement in your body is so important for us to be able to handle our environments.
I think we need to talk a little bit about the detox a little bit more and our liver. And because this is where I see a lot of women get tripped up when they take HRT and they're
Right.
excited to get on. They heard all the great benefits and then it backfires. They feel worse or something's
Yeah.
not right. And very often, not always, but it is their body's not detoxing it well. And then on top of that, maybe drinking alcohol, not realizing that needs to be detoxified as well. And so, why don't you talk a little bit about the detoxification of our hormones, whether it's you're
Yeah.
taking hormones or if it's your own hormones, how that works and what a woman needs to know
Yeah.
about
Yeah, so there's this enzyme called beta glucuronidase in the gut that is working with our liver to detoxify estrogens in our body. And so when the gut's not working well, when our microbiome isn't balanced, we may not have enough of that estrobolome, which is a group of microbiome bacteria that actually helps to detoxify those estrogens. And our liver, with its phase one and phase two, so phase one will take, for example, exogenous estrogen and make it a bit more toxic. Phase two will either methylate it or put a sulfur on there to make it less toxic, to get rid of it out of our body. And estrogen will only leave through our bowels. And if it doesn't, so if you're constipated, that estrogen is recirculating into the system. And if we think about our monthly bleed, it's a portal of detoxification. We're detoxing the month from before, emotionally and also physically. So women that have the heavier bleeds or the clots that they're seeing in their bleed is often due to those excess estrogens that are recirculating in their system. So by supporting your liver, whether it's through glutathione or things like DIN, B vitamins, turmeric, just habits around milk thistle, dandelion greens, eating bitter foods, all these things will support your liver, and then supporting your digestive system through prebiotics and eating variety of food, eating fiber, all of that will help to detoxify those excess estrogens. And on an emotional level, one of the biggest emotions that women will talk to me about around perimenopause and menopause is rage and anger. And in Chinese medicine, they say that we hold that emotion in our liver. And so there's this stagnation that happens, and anger actually increases pro-inflammatory cytokines in our body. So it makes us more inflamed. So when you start to see how connected our emotional body, our physical body, our hormonal system is, you start to see that it's like you do that one thing to support all of it. And then you do multiple things to support the one. Everything's working together in that symphony. So we can't compartmentalize hormones away from these systems.
it. Okay. You said estrogen can only get rid of, oh, we can only detoxify our estrogen through our bowels.
Through our bowels, yes.
We can't sweat it out or pee it out. It only comes out of our bowels.
From what I understand, my training there, it was predominantly it's going to leave through the bowels. Yes, we're going to sweat some out. It's going through our urine too, as we see through the metabolites. But those xenoestrogens, the exogenous estrogens, go through the bowels.
Okay, so xenoestrogens are the things that come from plastics or
Yeah,
certain plants. No, not plants, certain
pesticides.
pesticides, yeah.
Yeah,
Yes. And we don't realize, yeah, we're living a modern world and these happen. And even if you don't
yeah,
feel it, it has to come out. And I think it
yes.
build up over time. So what happens then if a woman is not focusing on the detox? What's going on in the body? What will she feel?
Fatigue is a big one. Inflammation. So water retention, her digestive system is going to be off. Most often there's constipation. So bloating is a big one. Headaches, brain fog is also present. So it's anything that you can associate with just feeling stuck in your body is going to happen if we're not detoxifying well.
Mm. You also mentioned the estrobolome, and I think we
Mm.
talk a little bit more about that. And you said there's this bacteria in there that can help detoxify the estrogen. So how do we support the estrobolome so we get the microbes we need?
Yeah, that's anything that's going to support health of your gut. So that's prebiotics. So those are your different veggies, and you can get prebiotic powders too if you feel like you're not getting the right amount of veggies in your daily practice. Fiber is the other piece, which I think is really important for women to have adequate amounts of fiber. And then the other piece is stress. So when we're under stress, we're actually shunting that blood away from our digestive system and we're not supporting our microbiome and it's actually changing our microbiome. So decreasing stress, supporting ourselves with nutrition that supports our body and our season, that's going to support that estrobolome.
When we think of stress, we often think about just overwhelm and feeling
Mhm.
stress. But does that also mean the stress that comes from exercise or fasting or things that
Mm.
causes stress, even maybe good for you, quote unquote, in certain dosage?
Yeah.
What?
Yeah, in that moment, it would because you're raising your cortisol, you're accessing the hormetic stress in your body, which is actually a good thing because you're coming down from it. It's the chronic stress that we live with. It's that hum in the back of our minds that's always there. It's the weight that's always on our shoulders. That is what we have difficulty digesting. So how we digest our food is a reflection of how we're digesting life. These hormetic stresses of working out, cold therapy for some, running a marathon, doing these things, these are great to bring resilience into the body. But when we're chronically stressed and we're chronically burnt out, that's where there's challenge. That's where we're not producing enough serotonin and we're not producing enough healthy bacteria in our body as well.
I see some women in our community who are overtraining and undereating, and I'd say it's a
Mm.
stress on the body. And when we remove the intense exercises and start feeding them again, their
Yeah.
gut issues improve. And
Yeah.
so I'm wondering, is this because they're feeding the estrobolome? They were maybe the estrobolome was off because they were overdoing these stress, and they became
Oh, yeah.
stressed.
Yeah, absolutely. It's when you're not body's not feeling nourished, it's not feeling safe. And your brain will literally go into that fight or flight mode to help you feel safe. It can't tell a difference. This is where that discernment is so important of what season you're in and where you are in your cycle for those that are still cycling when it comes to exercise and nutrition and just knowing your body and what it needs and how much it needs is so important to understand how we're going to feed that microbiome.
Yeah, okay. It's all tight. I just interviewed Cynthia Thurlow, who wrote the book
Yeah. Oh,
Positive.
yes,
So
that's right.
she was just, and in the book, it's everything's the loss of our hormones affects so many things in the gut and gut
Yeah.
specifically. It blew
Yeah.
my mind.
Yeah.
So I thought that was pretty crazy. So I to wrap it up here. I can't believe how fast the time.
I know that went by really quick.
Oh my goodness.
Yeah.
So my last question. Okay. If you could reframe menopause for women who are listening right now,
Mm.
what's the biggest mindset shift that would reduce fear and then help them feel empowered instead of broken?
Yeah, menopause is such an opportunity to finally live the life you were meant to. It's such a blessing to be able to look back at life, to be able to age, to be able to reflect on what didn't work for you and how your hormones now are giving you this opportunity to heal those stories so we don't have to pass them forward. And like stepping into your wise woman years is such a gift because you're coming in with all this wisdom of what worked and what didn't. And now you get to make that daily choice for you. And from that space, you're able to give to your world, to your community from such a different place instead of from a place of burnout or people pleasing, but just authentically from yourself. So I think menopause is a gift.
I like that. Menopause is a gift. Where can we get your book and
Mm.
learn more about it?
So you can go to the website healyourhormonesbook.com. You can also follow me on Instagram at Dr. Sonya Jensen.
Excellent. I'll have a link to that in the show notes as well as your website. Are you taking clients if
I
somebody wants to work
am.
with you?
Yeah, I'm still taking clients.
Oh, great. Okay, that's
I
wonderful.
love
And
my one-on-ones.
you're local, you're in the US, is that correct?
No, I'm in Canada,
Oh, you're
Vancouver.
in Canada.
Yeah.
Ah, okay. So, but can you work with both people in
Yeah.
Canada and US?
Yeah, absolutely. I have
And
patients all over the world. Yeah.
okay, so you're global. I love it. Wonderful.
Mhm.
Thank you so much, Sonia. You really cleared some confusion and answered my own personal questions too, which I love.
Good.
And I hope to have you on again. I'm excited to continue this conversation. And I want to thank everyone who's listened to the very end, who's obviously very curious about hormones. I hope you learned something new. Stay tuned. We'll always have more. And I hope you have a good day, good night, good morning, wherever you're at. And thank you, Sonia, for your time.